Hi, good afternoon, everybody. This is Ramina Zarm, owner and operator of Flex to Success Clinical Rehabilitation Services, and today I'm going to do a video on trichotillomania. Trichotillomania is defined as a mental illness which involves the inability of an individual to resist the urge to pull out their hair. This involves hair in the head, genitals, arms, legs, chest, eyebrows, eyelashes, feet, and anywhere else that hair grows. Recurrent pulling out of one's hair resulting in hair loss is one of the first criteria of trichotillomania. The second criteria is repeated attempts to decrease or stop hair pulling which have failed. The third is the hair pulling or hair loss causes significant distress or impairment in social or occupational functioning or other areas of important, functioning such as, activities of daily living. The next criteria is the hair pulling or hair loss is not attributable to any medical condition, and the last criteria is the hair loss is not attributable to any other mental health condition. So in terms of medical conditions that can be mistaken for trichotillomania, if somebody presents with alopecia, alopecia is a medical disease that causes your hair to fall out. You don't want to make the mistake of diagnosing somebody with trichotillomania, which is the manual pulling out, biting out, or ripping out of hair when somebody has a medical condition that causes their hair to fall out. Also, in terms of mental illness, people with psychotic disorders or people who are diagnosed with psychotic disorders will sometimes have a delusion, which is a false belief that their hair could be making them sick, or that there is bacteria in their hair that is dirty and causing them to get ill, so they might rip their hair out as a result of a psychotic episode like in schizophrenia. You don't want to mistake that for trichotillomania. The duration will be different, so that will help you to determine what is a psychotic disorder and what is a trichotillomania episode. The trichotillomania episode will be long-standing. It never goes away, it very rarely dies down or improves, and it's consistent over a very long period of time, consisting of years. The prevalence of trichotillomania is more common in women than it is in men when it comes to adults. The ratio for women to men with trichotillomania as adults is 10 to 1, so that's significantly higher for women. Some of the reasons that this might occur is that societally, people are a little bit more accepting of men losing their hair than they are of women. So that's just a theory on why it could be so prevalent with women. Men are less likely to seek help for something that they don't really feel is a big deal, whereas women feel shamed in society because of their hair loss, so they're more likely to seek treatment. Also, things to keep in mind in terms of doing therapy with somebody who has trichotillomania, you want to gauge their insight, of course. You also want to establish rapport, and it's usually not that difficult to address someone who has trichotillomania because people are usually pretty honest about the fact that they're pulling their hairs out. Some things that you might want to keep note of in terms of bad things that could happen to somebody who suffers from this illness. So people with trichotillomania have a tendency to bite their hair and swallow it. If they swallow too much hair, what they might end up having is something called a trichobasor. And a trichobasor is basically when you swallow an accumulation of hair to the point where it creates a gastrointestinal blockage and you're unable to pass stool. So it's, in the most simplest of terms, it's like having a big giant hairball blocking your intestinal tract and causing you to have constipation, be unable to pass stool, and be very uncomfortable and in pain. That is something that you would like to get taken care of right away through your medical provider. You'd want to be examined. You want to have tests done. Either your, a gastrointestinal doctor can also do it as well as a specialist. And you just want to make sure that you're not having any medical complications as a result of trichotillomania, because it is very common for people to bite their hair, specifically off their arms, and swallow it. That pretty much concludes my presentation on trichotillomania. I am trying to shorten my videos. I understand that some of my videos are very long and that it's hard for people to kind of find the time to sit through them and get all the way through. So this video is under 10 minutes. Hopefully you get a chance to watch it. And I will see everybody next time for excoriation. That will be the next disorder that I'll go over. Okay? Take care, everybody. Have a great day. If you have any comments, please leave it below. And bye.